Level 3 is anywhere from 80 to 90% effective. So this is the most effective treatment we have for allergies. Level 3 is called immunotherapy, and it involves or it includes three different options. The first one is allergy shots, which is 90% effective in the least. So it's very, very good. It's almost a cure. And the newer options in the allergy immunotherapy or level 3 category are sublingual allergy drops or sublingual allergy tablets. So I'm going to talk to you about shots here. So shots are an all-natural therapy. Actually, the sublingual is all-natural as well, which is very interesting because most areas of medicine, the best treatment is going to be another medicine. Think about heart disease, lung disease, liver disease. The best treatment is always another medicine. But if you have allergies, the best treatment is actually a natural remedy, which is your allergy shots or your sublingual drops or tablets. So the shots or the tablets or drops, they work so well because they're working at the beginning of this inflammatory reaction, not the end. So if we can get this reaction to stop at the beginning, then level 1 and level 2 don't really matter that much anymore because you're not having this happen anyway. So there are 3 companies in the United States that literally grow all the trees, grasses, weeds, gather the pollen. They actually are able to gather cat dander, dog dander, mold, dust mite particles, cockroach particles, all those nasty things, and put all that natural material into a solution of water basically. And then there's a little gentle preservative added. And then we buy the stock solution of all these natural allergic materials. So there's a little bottle concentrated of cat dander, concentrated of oak tree pollen, etc., etc. So whatever you're allergic to, we literally use that as a guide to make a mix for you, a solution mix. So let's say you're allergic to ragweed, grass, and cat. So we would literally pull from those stock solutions into bottles for you that are sterile with your birth date and your name, exactly what you're allergic to. So that's another thing about level 3 or allergy immunotherapy is that it is customized to you. The other level 1 and level 2 is not really customized to you, but level 3, we are literally looking at your results and making that mix for you. So getting it from the stock solution means that your first bottles are going to be very, very concentrated. So we dilute several times so that at the end it's still your mix, but it's much, much more watered down. It's not as concentrated, it's weaker. So, traditionally with allergy shots, there are 2 phases. There's the build-up phase and the maintenance phase. So the build-up phase means you would come into our office every week for 33 to 36 weeks, so a little bit of a time commitment there, and get your allergy shot or shots, and that's based on how many things you're allergic to. So let's say you would get 2 shots, and that would kind of include everything you're allergic to. So you would come in, get your shot. You would, before you get your shot, you would show us that you have your EpiPens with you or epinephrine auto-injector devices. I will go over why that's necessary in just a second. You will then get your shot and then you'll wait for 30 minutes, and I will also go over that in a second. So every week that you come in, the shot is going to be stronger than the week before. And we increase the strength by both volume and concentration. 9 months later, which is equivalent to that 33 to 36 weekly shots, we're at the very top dose, which actually was your original mixed dose. So we just worked backwards through the dilutions to get back to this really strong concentrated dose. So here we are, we can't go any higher. So we're done with this first phase of allergy shots, which is the build-up phase. All right, so then we go into the maintenance phase. Maintenance phase, you get the same strong dose over and over, but the good news is it's not weekly anymore, it's monthly. So the next question everybody asks me is, well, how long do I have to do this? Is this something I have to do the rest of my life? Is it 20 years, 10 years, 5 years, 2 years? We recommend 3 to 5 years of allergy shots because that's going to give you the best benefit. But keep in mind, most of that time, it's monthly. So you are really not having to have too much of a demand on your schedule. Now, the next thing to talk about is how do allergy shots work exactly. So by us literally giving you a shot of what you're allergic to, that's really not very natural because normally you're breathing in the things that you're allergic to. So doing it this way allows us to enter the part of your immune system that gives you allergies through the back door. So picture this is part of your immune system that's looking at the front door, waiting for your allergies to come through so they can fire at it and cause all this inflammation. But the shots or the tablets or the drops will come through the back door, tackle that part of your immune system down, and force it to take what you're allergic to over and over and over again at increasing doses until that allergic part of your immune system says, okay, I give up, I'm overwhelmed, I'm drowning, I'm going to stop having this reaction because I can't take it anymore. So it's kind of like a forced exposure, and the reason that it works is because we are coming in through the back door with the shot. So it's not an overnight thing. It takes time for us to kind of manipulate that part of your immune system and expose it over and over again. So most people start to feel better anywhere from 3 to 9 months after having had the first shot. So let's say you start allergy shots, 4 months in, you wake up one morning and think, you know what, I've been better these last few weeks. And then you'll notice that you continue to get better, because if you think about that, that 9-month period kind of mirrors that buildup phase. So by the time you're up to the maximal dose and you're on maintenance, the neat thing is most of my patients continue to feel better. So even with the same dose, year 4 is better than year 3, is better than year 2, etc., etc. So that's kind of how allergy shots work. So it's a process of desensitization, and again, it's because we're able to purposely expose you to what you're allergic to through the back door. All right, the next thing is side effects to allergy shots. The main side effect is an itchy bump right where you get the shot. This is pretty common, but it's really minor. It's nothing that we really worry about. In the scheme of things, as far as how severe an allergic reaction is, an itchy bump at the shot site is not very severe. We're not that concerned. The reaction that we get concerned about is the much more serious anaphylaxis reaction, also known as anaphylactic shock or anaphylactic reaction, anaphylaxis. So this is really rare with shots, so don't get too scared, but it's possible. It happens in about 1 person getting shots out of every 250,000 people getting shots, so pretty rare, but still, because you have a little bit of a risk, that's why we give you the epinephrine autoinjector device or EpiPen. So basically, if you were to have this anaphylactic reaction to shots, and by the way, anaphylaxis is the same reaction that you hear of people having that are really allergic to shrimp or peanuts or bee sting or penicillin. So the classic story is, let's just imagine a woman who's very allergic to shrimp. She goes to a restaurant, she tells her waiter, she tells the cook, but somehow she accidentally gets a piece of shrimp under her chicken and she's eating it. And usually the person who gets that trigger that they're really allergic to will have the anaphylactic reaction anywhere from the time they get the trigger up until 4 to 5 hours later. But it's usually fast. It's usually within the first 30 minutes. So let's say she ate the shrimp. The classic progression for anaphylaxis is itchiness and hives all over, followed by lip swelling, tongue swelling, throat swelling. This is pretty serious because your big airway's right here, so if your throat starts swelling and squeezing down on your airway, then you may start to feel like this, or you can't swallow, or there's a lump in your throat. Your voice might change, you might get hoarse because your vocal cords are right here, and that may start getting swollen as well. Your lungs can get involved, coughing, shortness of breath, wheezing, tightness. And then your blood pressure can go down. If that happens, you start to get real lightheaded and woozy, and some people actually pass out. And then the last system classically to get involved is your GI system. So stomach pain, nausea, diarrhea, vomiting, any of those things. Now, if you'll notice, I went from mild anaphylaxis all the way to severe anaphylaxis. But keep in mind, it doesn't always happen that way. I had a patient once with a bee sting allergy, and the very first thing she did after getting stung was pass out cold. There was no hives or swelling. All of that didn't happen. She just passed out. I had a little boy with a peanut allergy years ago who would eat the peanut. 5 minutes later, he would have this profuse diarrhea. So automatically, those two patients were in the severe category. They didn't follow the pattern. So keep in mind that even though that's classically what happens, and that helps you kind of remember what could happen, it doesn't necessarily have to happen in order. Sorry.